for our weekly update here in Mississauga. I'm pleased as always to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here at Peel. Mississauga has now been in the grey lockdown zone for approximately 17 days. And while we are still seeing high daily case counts, things are beginning to stabilize a little. We are not seeing the exponential growth that we saw in late October through the beginning of November. Over the last week, Peel Region has averaged 459 daily cases, with Mississauga averaging 152 daily cases, and that is slightly up from the previous week. In Mississauga, we rose slightly to 132 cases per 100,000, which is 13 higher than last week. The hope is that our case numbers will soon begin to plateau and we will see them decreasing in the coming weeks. What's very clear is that without the lockdown measures, our cases would have been much higher over the past 2 weeks. The reality is that with other regions not currently in lockdown, they're facing community spread at an alarming rate. While we've seen some promising news, the situation at our hospitals is not getting any better. And this is particularly concerning as we know our hospitals are our last line of defense in protection against this virus. Trillium Health Partners is currently well above capacity and is dealing with 88 COVID patients and 20 patients in the ICU, and with a great number of patients awaiting their results pending. Trillium Health Partners has also seen an increase in cases amongst staff members, with 31 employees recently testing positive for COVID-19. 4 units are in outbreak at THP, and they've begun transferring patients to other hospitals and are considering cancelling some elective surgeries. I've been told that the next 3 to 6 weeks will be extremely challenging for our hospitals as they continue to deal with the surge of COVID patients. In Brampton, William Osler Hospital has 80 COVID hospitalizations with 13 COVID patients in the ICU and another 50 suspected cases. Every week I reference these numbers, but I want everyone to remember that these numbers are real people who are suffering from the virus, real people who are hospitalized, real people who are being transferred to the ICU. It's real people, our residents at our long-term care homes, the 10 retirement homes, and the 4 group homes who are dealing with COVID outbreaks. It's real people, our residents who are dying from this virus. I want you to remember that when we debate restrictions and talk about the unfairness of the lockdown measures. It's easy to lose sight of why we are doing this, but we have to remember we're making these sacrifices to protect our most vulnerable residents. I want to take a minute to thank all of our frontline workers once again, and those who are working in our congregate living settings, and our team of doctors and nurses and support staff at Trillium Health Partners under the leadership of CEO Michelle DeManuel. You are doing incredible work, and you continue to show courage in the face of great adversity. I realize that everyone is growing tired of COVID restrictions. Of course you are. I am too. I really want us to move out of lockdown as soon as we possibly can. Last week, Regional Council passed a motion that asked our Medical Officer of Health to look at the COVID situation at the individual municipalities within Peel when making decisions about loosening restrictions. And I support this motion because I think it's only fair to Mississaugans to do so. And while I would love to start advocating about lifting the lockdown restrictions here in Mississauga, our case numbers are not quite there yet. Recall that I said we are at 132 per 100,000 cases, and to be out of lockdown and into the red zone, we would have to be at 40 cases per 100,000. So no, we are not there yet. And I'm not sure whether we will see the loosening of restrictions from the province before the holiday season. And I know it's hard to hear that. But again, we have to remember why we are doing this. Any wrong move at this point could be disastrous for our community, for our municipality, for our city, and for our residents, and especially at a time when the vaccine is on its way to Ontario. Today it was now announced that Health Canada has approved the Pfizer COVID-19 vaccine. I also had the opportunity yesterday to speak with the Premier as well as General Rick Hillier, the Chair of Ontario's COVID Vaccine Task Force, about the rollout for the province. Ontario is expecting to receive its first shipment of the vaccine in the coming weeks. Over the next 4 months, the province will receive 2.4 million doses, mostly from Pfizer and then later from Moderna as well, enough to immunize 1.2 million people, as each person requires 2 doses. This will be the first phase of the vaccine rollout, and it will, of course, be our frontline healthcare workers, residents at the long-term congregate living centres, and the most vulnerable in our population who will receive the initial vaccines. The Pfizer vaccine will be stored at 23 hospitals across the province that have the deep freezer capabilities needed to store this particular vaccine at temperatures below 75 degrees Celsius. Our hospital, under the leadership of Michelle D'Emmanuel at Trillium Health Partners, will be one of those leading this initial effort. Because of the cold storage requirements for the Pfizer vaccine, these doses will be used for our frontline healthcare workers who are able to go directly to the hospitals to receive it. I was very happy to hear from the Premier and General Hillier that hotspots like the region of Peel will be prioritized and will be among the first to receive early doses. Phase 2 will likely begin around April, when the federal government will begin to secure more of the vaccine from multiple pharmaceutical companies. The priority, again, will be, of course, our vulnerable communities and our essential workers, and the province is hoping that most Ontarians will begin to have access to the vaccine at this point, but more likely a little further down the road. People will have to be patient during this time, as the phase will take likely between 6 to 9 months to immunize the majority of our population here in Ontario. The final phase will see immunizations move from designated vaccine sites to pharmacies and clinics to doctors' offices, similar to how you receive your seasonal flu shot today. But what's clear is that we now have an end game in sight. There's very promising news, but we still have a huge challenge in front of us, including avoiding school closures, avoiding putting extreme pressure on our hospitals, and further spread in our long-term care homes. I want to thank the vast majority of our residents and our businesses who continue to play their part and listen to public health advice. I was very encouraged that of the nearly 2,700 proactive business inspections that our bylaw officers conducted last week, 99.7% were in compliance. That's great news. We did, however, issue 15 tickets to non-essential businesses that opened for in-person shopping, as well as 11 tickets to individuals gathering in numbers above the lockdown rules. Our enforcement teams have stepped up their activities and recently added 4 new members from other city departments. We have begun to redeploy people from those who have been laid off as a result of the lockdown. This sends a strong signal to the community that we are taking the lockdown seriously and that we will not hesitate to charge people who think that the rules do not apply to them. We are all in this together, and we all have a duty to be responsible. I want to encourage, again, everyone to support our local businesses during the holiday season. Shop from one of our local businesses online, or call them and order a gift certificate. Or take out from one of our world-class restaurants. And by doing this, you are making a difference in their lives and in their businesses. Small businesses need our support in addition to the support that they're receiving from the province and from the federal government. It's Wednesday today. It's the perfect day to get over the hump and order online or for pickup or for delivery. To all residents, please remember to stay home, except for the essential activities like groceries or going out to the pharmacy to get gas or to get exercise. Please limit your in-person contact to just those in your immediate household. Thank you. I'd now like to invite Dr. Lowe up to give his remarks.
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 10,178 cases of COVID-19 in Mississauga. 948 are active, 8,951 are resolved, and 279 have passed away. Mississauga's test positivity rate stands at 7.1%, and cases are now at 132.6 per 100,000. We are seeing increasing hospitalizations and intensive care strain in our hospital system in the region of Peel, several long-term care outbreaks, and also more and more cases identified in our school system. This is a direct result of the high levels of transmission that we are continuing to see in our community, and I want to be clear that our thoughts are very much with those that are affected. I also want to share that over the summer, Peel Public Health worked hard to prepare for this second wave. We hired hundreds of new staff to help with case and contact management and outbreak investigations. We implemented the province's new digital system for case and contact management, supported a safer school reopening, pursued a voluntary isolation center, and have engaged with partners at the provincial level and throughout the community in making workplaces and high-priority neighborhoods a priority. We also continue to work with those community partners to target messaging and understand how inequities continue to drive transmission in Peel. This has all bought our community time through September and mid-October. We managed to stave off the second wave and kept things under control until after the Thanksgiving surge in known clusters. But I must be very clear. Things are different now. Cases have grown, and some of those always become hospitalizations and, on occasion, deaths. That is the numbers cascade that has defined 2020. Thankfully, 2 weeks into the grey lockdown category of the province's framework, we are seeing the pace of case growth slow somewhat across all three of our municipalities. But the point is that our cases are still growing, not as fast, but still heading in the wrong direction. We are not yet seeing a plateau or a decrease. And if we remember how the first wave in the spring worked, we don't start going down right away. A plane needs to level off at cruising altitude before coming back to Earth. I don't want to think about what our cases would have been had the measures not come into effect. And while I'm glad that a vaccine has been approved, and Peel Public Health is working furiously with numerous partners to figure out how it's going to roll out around our region, it's not widely available yet, and it's not doing any of us good if it hasn't yet been administered. So for that reason, we must stay the course. We must stick to precautions to bring this under control, bring this wave under control, and then drive down cases through our continued collective action and determination. If we reduce cases, reduced hospitalizations and deaths will follow. We also need to support our businesses that are doing the right thing, who are staying closed and sacrificing to keep all of us safe. I also want to thank those businesses for doing their part to make sure that more of our residents will live to see better days. And beyond our homes, all of us can do our part to minimize our in-person interactions to only what is necessary. Fewer interactions means less risk, less transmission, and a quicker return to community control of this virus. So please, do your part. Close contact only with those you live with under the same roof and 1 or 2 essential supports, and virtual with everyone else. And where you must meet in person for an essential reason, always distance, always wear a mask, and do not go if you are sick, even in the slightest. We also know that there are those in our community who can't do this effectively due to their work or living situations. Peel Public Health is committed and to continuing to work with partners to address disparities through the deployment of additional supports to fix various factors that render people vulnerable. We hope to be able to announce additional initiatives to support our essential workers and our most vulnerable in the coming days. Finally, I know this time of year is special for many, but please, no gatherings or celebrations of any kind. Your sacrifices will save lives and help more of us to see a better holiday season in 2021. Let's not give COVID any additional chances to spread. Host your celebrations virtually and plan for some real celebrations later in 2021 when hopefully we start to see the benefits of the vaccines over our widespread use in the community. And remember, the higher up we go on the disease curve, the longer it takes for us to come down. We must hold the line here, and if we do not meet, the virus cannot spread. This remains the great group project of our time, and I want to thank Mayor Crombie and Council and all of you in our community for your continued work together in beating back COVID-19. Thanks, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. I just want to acknowledge the tremendous work of Dr. Lowe and his incredible team. You've put in such long hours, and you've often had to provide us with some very tough advice, Dr. Lowe, so we all thank you. And I just want to say how lucky we are to have such a dedicated medical officer of health as Dr. Lowe and the public health unit that we do have, so thank you. And just before I take questions from the media, I want to talk to you a little bit about staying healthy this winter season. I realize that many people are struggling to get the kind of physical activity that they need with community centers and gyms are closed right now, and recreational sports have pretty much been put on hold. I know I'm finding it tough to work out. I've been doing so in my own home, but you need a little more motivation than that sometimes. City staff, however, they've been working hard to get our outdoor spaces up and running with winter activities for you, for our residents. Our Celebration Square ice rink will be opening beginning this Friday. That's exciting news. Always a wonderful place to go. Residents don't have to make a reservation there. They can show up and skate anytime between 10 a.m. and 9 p.m. But of course, there will be strict physical distancing measures in place. We will be honoring capacity limits. So staff will be on site to ensure that the right rules are being followed. Chick Murray Arena at our Burnhamthorpe Community Centre will be open this weekend as well for public skating, and people can reserve their spot in advance at activemississauga.ca. We're anticipating that our Woodhurst rink will be open next weekend, where reservations will also be required for a time slot. We also have 26 natural ice rinks open to the public to use during the winter season that are maintained by community members. Many will be up and running this season, weather permitting, of course. The majority of the city's trails will be receiving regular winter maintenance and can be safely used for winter hiking. I tend to prefer hiking over skating, to be honest. I don't have the same ice skating skills that Hazel McCallion has. This city's more than 500 parks will be open for people to go tobogganing, enjoying the playgrounds, or perhaps even having a winter picnic with their immediate households. The city is keeping outdoor courts open in our parks for those who are brave enough to try a little winter tennis or shoot some hoops. Just be careful, tennis balls in the winter sting a little more than they usually do in the summer months. Many of our parks will also have year-round washrooms that are open to the public. And the city has also begun placing portable washrooms in high-use trail areas. I know that outdoor winter activities aren't everyone's cup of tea, but I really do encourage residents to give something new a try this winter. Please remember to only do so, only participate in those activities with members of your immediate household. For more information on skating and the amenities that will be available at our parks, please visit the City of Mississauga's website. And now, I'm pleased to take questions from the media.
Your first question comes from Nick Boisvert at CBC News. Go ahead, Nick.
Hi, thanks. Hi, Mayor Crombie. Question for you about public transit. We've heard some concerns and seen photos from people who are still riding the My Way buses, even during lockdown. And it seems that some of them are still quite crowded, physical distancing not possible. I'm just wondering what you make of that, and whether you think, given that it's probably a lot of essential workers who are still relying on these buses, do you feel that the city is doing enough here to make sure that they have a safe way of getting to work?
Nick, thank you for that question. This is very important information. In fact, we were having this discussion at council today, and our commissioners and city manager were informing us that our buses are running at about 30% capacity, and that was down from about 50% capacity a month ago. So I don't know how recent those photos are taken, but if you could please share them with us. Maybe you can tweet them or send them over to my office, mayor@mississauga.ca. I would be very interested in seeing which routes those are and whether or not we would need to add additional buses on those specific routes. But of course, we are doing whatever we can to protect our drivers, our ATU transit drivers, and of course our passengers as well. So I know we have plexiglass barriers set up for our drivers, and we have closed off many of the seats to ensure safety of our passengers. But if there is a specific problem, we are happy to look into it, but it's not the news we had been receiving this morning. So please send that over if you would.
Follow-up?
Yeah, sure. I can maybe do that a little afterwards. But for the people who are still riding these buses, this week the city announced some reductions on a few lines, apparently during sort of off-peak hours. Do you think that there's a possibility of maybe if services lowered on certain times to divert those buses to routes that are busier? Would you like to see a commitment made, or can you commit to doing something like that where you get more service onto some of these busier routes?
Oh, absolutely. This is something we spend a lot of time and look very closely at, Nick, so we would certainly do that. The only routes that have been cancelled or have seen a drop in service are the ones that, for instance, are express buses to the airport, etc. So if there are routes that are not heavily in demand, those buses, those MyWay buses can be diverted. We look very closely at that. We know where our buses are at all time and what the capacities are. We have a big control room right at our MyWay head offices. So certainly if you have differing information, please send it to me, mayor@mississauga.ca, or you can, I know some people put it up on Twitter if they've missed the bus or the bus is, whatever the situation is, late. So we do hear about it and we do respond to people. So please share the information with us.
Your next question comes from Steve Cornwell at Mississauga News. Go ahead, Steve.
I'm Mayor Crombie. How are you?
I'm very well, Steve. How about you?
Not too bad. I wanted to ask you about some of the measures that were approved at council today to allow businesses to open up outside and some recreation stuff to happen outside. I understand that it will be kind of rolling out in the new year, but I just wanted to clarify first whether you're thinking that, or assuming, I guess, the city's assuming that the lockdown will be over then, and if not, does that impact the city's plans?
So it does not impact the plans. These are safe activities outdoors, such as drive-in movie theaters or winter markets that have strict capacity limits. Anything that is a safe activity outdoors is what we had envisioned.
Sure, and thank you for that. I'm just wondering about kind of the overall message it's sending here, because my understanding, and perhaps Dr. Lowe can speak to this as well, is that while kind of exercise is a valuable quantity, let's say now, as we're in this kind of lockdown period, my understanding is that we're only supposed to be going outside for essential kind of trips. So I'm just wondering if this is sending a message that's kind of against the recommendations at this moment.
I think the message is consistent. Go out for the essentials as little as possible, but certainly with respect to exercise, that is essential. And I encourage people to go out as often as they can, whether it's a walk in the park or on a trail or a bike ride or whatever they're comfortable doing, ice skating, etc. Everything I had listed earlier, we certainly encourage people for their mental health, their physical health, to go outside and take in the fresh air and exercise. I know it's certainly been helping my mental frame of mind too. I've been working out. I hope you have, Steve, as well.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Hi, Mayor Crombie.
Welcome, Ashley.
Thank you. So I actually wanted to ask about your the city's climate change action plan, because I know the city recently announced the new hydrogen fuel cell electric bus pilot, and I know at the end of last year it was reported that the climate change action plan would probably cost more than $450 million. With COVID causing such issues, not just for all cities, but the city obviously experiencing big financial from it. I'm actually wondering if the city is still on track to fulfill the objectives of this plan within the next 10 years, or if you're going to have to scale back or reevaluate in the new year, especially if lockdown measures and the reduced revenue that comes with it continues to last into 2021.
It's an excellent question, and I think Khaled asked me yesterday, but it is a $450 million climate action plan. We are one of the first cities to declare a climate change emergency, so we are very dedicated to our plan. Many of the items set aside in the 10-year plan are on the capital side, such as the hydrogen program, the hydrogen bus program, which is a pilot project, and we're very hopeful that we find new technologies that actually we could realize a savings and could be more cost effective and cost efficient. So no, we're very committed. It's on the capital side. It's a big commitment, but it is part of our long-term plans. Nothing has been cut from that program as of yet. We'll wait and see next year, but we're very cautious here, and we're very fiscally responsible. We think it's the right thing to do to maintain our commitment to climate change, and we're also hoping that we will realize savings in the future too.
Follow-up?
Thank you. My next question is for Dr. Lowe.
Certainly.
Hi, Ashley. Go ahead with your question.
Hi. So I wanted to ask about schools. I know there's been one public school in particular, Mississauga Fairview. I know that the Region of Peel announced that it was rolling out testing tomorrow at that school because there's been an outbreak. I know that recently the province said that it's going to allow more voluntary testing, or bring more voluntary testing rather, to schools in Peel. I was wondering if you can kind of speak to that. Like, how many schools do you think are going to be getting testing in the schools in the next little bit? And do you foresee some temporary school closures in the future? Do you think that there's a chance that the virus is spreading asymptomatically more at schools than we first anticipated?
Yeah, thanks for the question, Ashley. I want to stress that we have, together with the ministry, offered testing, I believe, at 9, now 10 schools with the recent school in Mississauga for schools that are actually in outbreak. This is a way for us to very quickly identify any additional cases. And you can refer to our weekly epidemiologic report from, I believe it was 2 Fridays ago, where we actually go through some of the data that we've identified in the course of these investigations. At this point in time, we haven't necessarily seen, and are fairly confident of this, widespread transmission in schools. The cases and outbreaks that we are seeing in schools tend to reflect the high rates of transmission that we're seeing in our communities. And so I think there's a suggestion that the precautions that have been in place have been somewhat helpful in terms of keeping schools a safe spot for learning, and also recognizing that there are tremendous benefits to having children in school for their socialization, for their learning and development, for their mental health and well-being, and so to the extent that we can preserve that, that's really important. On the topic of additional temporary school closures, where there is an outbreak identified and it is necessary, either on an operational basis or otherwise, we will work with our school board partners to close schools and certainly offer testing and whatever other interventions may be warranted. Although I will note that we all know that the fall term comes to an end as of next Friday. So thanks very much for the question, Ashley.
Your next question comes from Vioza Asai at The Pointer.
Welcome, Vioza.
Vioza, are you there? Okay.
She may have dropped off.
Your next question comes from Khalid Salama at My Second Home TV.
Welcome, Khalid.
Thank you, Mayor, and thank you, Daniel. You got it right. Actually, I missed some updates today. You mentioned something about in the council meeting about the bridge from QW and the heritage, whether it will be demolished or something. What did I miss? Because I joined just a little bit late. Can you please update on that?
I'm sorry, what did you ask specifically? I didn't quite hear you.
In the council meeting today.
Correct.
You mentioned something about the bridge on Credit River.
So okay.
I missed that.
No.
I'm sorry.
Okay.
So can you update it? Yes.
That was part of a larger discussion around a valve compound, but we are very pleased that we are preserving that historic bridge. We think it's a real treasure. This is a very unique, and it should be under heritage protection, really, bridge across one of our more prominent waterways. And the province had initially thought it would be more cost-effective to tear it down and to expand it to be built new. But of course, the council and our residents, we objected, and we said it's a beautiful bridge. Please don't demolish it. Find a way to expand it without tearing down the bridge. So no, that will be preserved. And then we went into a further discussion on a valve compound that had to be moved as a result.
Yeah, this is the one on Credit Valley near Mississauga Road on QW, right?
That's correct. Goes over the Credit River. It's a beautiful bridge. Don't you agree? That's right.
Yeah, thank you so much. May I ask Dr. Lu?
Absolutely.
Thank you so much.
Hi, Khaled. Go ahead with your question, please.
Sorry, Dr. Lu. Today there was a mention about allergy side effects for the COVID vaccine. Can you please highlight this?
Absolutely. Thanks very much for the question, Khaled. As you know, this is just initial case reports that are coming out of the UK that individuals with severe allergies may be having an allergic reaction to the vaccine. This is all part and parcel of ensuring that vaccines are safe and effective. And having worked at the federal level in vaccine safety, I absolutely know that when there's some sort of signal, they are all over it to make sure that it's related to the vaccine, what caused it, what might be happening. And so we have to remember that this is the ongoing post-rollout surveillance that every country undertakes to make sure that the vaccines that are being deployed continue to remain safe and effective as per the data that was studied before its approval. It's really important to highlight that in the course of the trials up until the approval, side effects were really quite rare. They were usually very mild. The data that has been published to date, at least on the Pfizer vaccine that I've seen, have shown that this is a very safe and a very effective vaccine, which likely led, I would imagine, to the approval with our federal counterparts today. And so it's really important to remember that what you are seeing, or at least the allergic side effect that is being under investigation right now in the UK, is all part and parcel of making sure that we are getting the benefits of this vaccine while ensuring its safety. And so we'll look to see what our UK counterparts find from their investigations. Thanks, Khaled, for the question.
We were able to get Fioza back. She's on the line right now.
Fioza, welcome. It's Mayor Crombie.
Hi, Mayor Crombie.
Thank you.
Both my questions are actually for Dr. Lowe.
Okay, no problem. Here, I'll bring him up.
Sorry, Madam Mayor, and go ahead, Fioza.
Hi, Dr. Lowe. So in the past, you've talked about how some of the social determinants of health have driven transmissions in the region. How is Peel Public Health planning to apply some of those lessons to ensure equitable access to the vaccine for racialized communities and other at-risk populations?
It's a great question, Fioza. We will continue to take our guidance from the provincial task force on immunization delivery, as you know, the one that was rolled out. They have a bioethicist on there, Dr. Maxwell Smith, who is very familiar to us at Peel Public Health because he has worked with us on equity and ethics. And so we'll be very curious to see what the province has in respect of that. And as always, in any rollout, we will take our direction from the province and then work with our local partners, including local community agencies, to make sure that the vaccine is getting to those who need it the most, who are most at risk, and certainly those who are most vulnerable in our community. But again, at this point in time, it really is about seeing what Dr. Smith, as well as the rest of the provincial task force, comes up with, at least as overarching guidelines.
Follow-up?
Yep. So I'm sure you're also following the situation out in York with regards to hospitals reaching a tipping point. I'm just wondering if you're seeing any parallels with Peel. I know this morning in Mississauga at Council there was some conversation about perhaps loosening restrictions when it would be appropriate. I'm just wondering if you could comment on some of the parallels or where the trajectory in York is going and how it could affect Mississauga.
Well, as you know, Viosa, I can't really comment on what's happening in York Region with any sense of expertise because I do have my counterpart, Dr. Kareem Kurji, who is in York and who'd be able to speak to the situation there with much more facility than I would. You know, the tipping point that I understood from the media that York hospitals are potentially reaching are tipping points that our hospitals have already crossed in terms of cancelling surgeries as well as transferring patients and also offering care in non-traditional spaces. So if that's a situation that is unfolding in York, then you know, I certainly you know, I would encourage you to reach out to them to understand fully what the situation might be in their community. Thanks so much for the question.
That wraps up our press conference for today. I thank everyone for joining us, and we'll see you for our final press conference of the year next week.
Thank you, everyone.